Dementia isn't just a normal part of aging. It's a severe cognitive disorder that profoundly affects memory, thinking, behavior, and the ability to perform everyday activities. While dementia has many causes, some might surprise you, like certain medications that many of us take regularly. Today, we'll uncover 15 types of medications that could significantly increase your risk of developing dementia. To understand the full extent of this risk, we'll dive deep into each medication, providing insights and essential information you need to protect your brain health. Dementia is a growing concern worldwide. With around 50 million people currently living with dementia and nearly 10 million new cases each year, it has become one of the most significant public health challenges. Dementia is the fifth leading cause of death globally, and its prevalence is expected to rise as populations age. While many people are aware of the genetic and lifestyle factors that contribute to dementia, the role of certain medications is often overlooked. This oversight can be costly because the very drugs designed to help with one issue could silently be harming your brain, leading to cognitive decline and eventually dementia. Before we dive into the medications that could be increasing your risk of dementia, make sure to subscribe to our channel. Your support helps us continue to bring you important health information, and it will help us reach our next milestone of 500 subscribers. Now let's get into the details. Let's delve into 15 types of medications that have been linked to an increased risk of dementia. Each of these medications serves a purpose, whether it's treating allergies, anxiety, depression, or other conditions, but their impact on brain health is something that cannot be ignored. 1. Anticholinergics. Medications like diphenhydramine, Benadryl, and oxybutynin, Ditropan, are commonly used for allergies and incontinence. These drugs block acetylcholine, a neurotransmitter critical for memory and cognitive function. Prolonged use of these medications has been linked to a significant increase in dementia risk. The anticholinergic effects on the brain can lead to cognitive decline, making these medications particularly concerning for long-term use. 2. Benzodiazepines. Examples include diazepam, Valium, and alprazolam, Xanax. These drugs are frequently prescribed for anxiety and insomnia. Benzodiazepines work by depressing the central nervous system to calm the brain. However, this calming effect can also impair memory and cognitive function, particularly with long-term use. Studies have shown a strong association between prolonged benzodiazepine use and an increased risk of dementia, especially in older adults. 3. Tricyclic antidepressants. Common antidepressants like amitriptyline and imipramine are used to treat depression and certain chronic pain conditions. These drugs have significant anticholinergic properties, which interfere with the brain's neurotransmitters. Long-term use of tricyclic antidepressants has been linked to an increased risk of dementia due to their impact on memory and cognitive function. 4. Antipsychotics. Medications such as haloperidol, Haldol, and Risperdal are prescribed for conditions like schizophrenia and bipolar disorder. These drugs can impair cognitive function by altering the balance of neurotransmitters in the brain. Prolonged use of antipsychotics has been associated with a higher risk of developing dementia, particularly in older adults with pre-existing cognitive impairment. 5. Proton pump inhibitors, PPIs. Drugs like omeprazole, Prilosec, and lansoprazole, Prevacid, are used to treat acid reflux and gastroesophageal reflux disease, GERD. Although effective for controlling stomach acid, some studies suggest a link between long-term use of PPIs and an increased risk of dementia. The exact mechanism isn't fully understood, but the potential impact on brain health makes it a concern for those using these medications for extended periods. 6. Sleep medications. Zolpidem, Ambien, and esopiclone, Lunesta, are commonly prescribed for insomnia. While these medications help with sleep, they also impact the brain's natural sleep-wake cycles. Over time, sleep medications can impair cognitive function, leading to an increased risk of dementia with long-term use. It's important to use these medications cautiously, particularly in older adults. 7. Antihistamines. Medications like diphenhydramine, Benadryl, are used to treat allergies. These drugs are widely available over the counter and often used for their sedative effects. However, Their anticholinergic properties can impair cognitive function over time, leading to an increased risk of dementia, particularly when used frequently or over long periods. 8. Corticosteroids. Prednisone and dexamethasone are commonly prescribed for conditions involving inflammation, such as asthma, arthritis, and autoimmune diseases. While effective in controlling inflammation, corticosteroids can have significant side effects, including cognitive impairment. Long-term use has been linked to an increased risk of dementia, particularly in high doses. 9. Statins. Atorvastatin, Lipitor, and simvastatin, Zocor, are used to lower cholesterol and prevent heart disease. While these drugs are effective for cardiovascular health, some studies have raised concerns about their impact on brain health. There is ongoing debate about whether statins increase the risk of dementia, with some studies suggesting a link to memory loss and cognitive decline, particularly with long-term use. Number 10, beta blockers. Common beta blockers like propranolol and atenolol are prescribed for high blood pressure, heart rhythm problems, and anxiety. Beta blockers work by reducing the effects of adrenaline on the heart and blood vessels. However, they can also affect brain function, potentially leading to cognitive decline and an increased risk of dementia over time. 11. Opioids. Medications such as morphine and oxycodone are used for pain relief, especially in chronic pain conditions. While opioids are powerful painkillers, they also have a profound impact on the brain, particularly in terms of memory and cognitive function. Long-term use of opioids has been linked to an increased risk of dementia, making them a concern for those using these medications for extended periods. 12. Anticonvulsants. Drugs like phenytoin and carbamazepine are used to control seizures in conditions such as epilepsy. These medications work by stabilizing electrical activity in the brain, but they can also impair cognitive function. Prolonged use of anticonvulsants has been associated with an increased risk of dementia, particularly in older adults. 13. Antihypertensives. Medications such as hydralazine and methyl-dopa are used to lower blood pressure. While controlling blood pressure is crucial for heart health, some antihypertensives have been linked to cognitive decline and an increased risk of dementia, particularly with long-term use. It's important to monitor cognitive health in individuals taking these medications, especially as they age. 14. Antibiotics, fluoroquinolones. Ciprofloxacin and levofloxacin are potent antibiotics used to treat a variety of bacterial infections. Although effective, fluoroquinolones have been associated with neurological side effects, including memory problems and confusion. There is growing concern that repeated use of these antibiotics may increase the risk of dementia, particularly in older adults. 15. Non-steroidal anti-inflammatory drugs, NSAIDs. Ibuprofen and naproxen are widely used to relieve pain and reduce inflammation. While NSAIDs are effective for treating conditions like arthritis, some studies suggest that long-term use may contribute to cognitive decline and an increased risk of dementia. The exact relationship between NSAIDs and dementia is still under investigation, but it's important to use these medications with caution. In addition to being aware of the medications that may increase the risk of dementia, it's important to know that some medications may help manage symptoms or potentially reduce the risk of cognitive decline. 1. Donepezil, Aricept, a cholinesterase inhibitor that helps increase levels of acetylcholine, a neurotransmitter important for memory and learning, to help manage symptoms in Alzheimer's patients. 2. Rivastigmine, Exelon, another cholinesterase inhibitor. This drug helps slow cognitive decline by preventing the breakdown of acetylcholine, supporting memory and thinking abilities. 3. Memantine, Namenda, an NMDA receptor antagonist that helps regulate glutamate, a chemical involved in learning and memory, often prescribed to moderate to severe Alzheimer's patients. 4. Galantamine Razodine. This medication works by both increasing acetylcholine and stimulating nicotinic receptors in the brain, which can improve cognitive function in Alzheimer's patients. 5. Namzaric, a combination of donepezil and memantine. This drug offers a dual approach to managing Alzheimer's symptoms, targeting different pathways in the brain to help preserve cognitive function. The medications we've discussed play critical roles in treating various conditions, but their potential to increase the risk of dementia cannot be ignored. If you or someone you know is taking any of these medications, it's vital to be aware of the risks and consider discussing alternatives or preventive measures with a healthcare provider. Dementia is a serious condition, and taking steps to protect your brain health is essential. In contrast, there are also medications that may help manage dementia symptoms or slow cognitive decline. These medications, while not curative, offer hope in preserving cognitive function and improving the quality of life for those affected. Donepezil, Aricept, is a cholinesterase inhibitor that increases acetylcholine levels, which is crucial for memory and learning. It's often prescribed to manage symptoms in Alzheimer's patients. Similarly, rivastigmine, Exelon, works by preventing the breakdown of acetylcholine, thus helping to slow cognitive decline. Memantine, Namenda, an NMDA receptor antagonist, regulates glutamate, another chemical involved in memory, making it a common prescription for moderate to severe Alzheimer's. Galantamine, Razidine, which also increases acetylcholine and stimulates brain receptors, can enhance cognitive function. Finally, Namzaric, a combination of donepezil and memantine, provides a dual approach to managing Alzheimer's symptoms, targeting multiple pathways in the brain to help preserve cognitive function. In conclusion, the relationship between medications and dementia is complex. While some drugs may increase the risk of cognitive decline, others can help manage or slow the progression of dementia symptoms. It's crucial to be informed about the medications you or your loved ones are taking and to have open discussions with healthcare providers about the potential risks and benefits. By taking proactive steps, you can help protect your brain health and improve your overall quality of life. Stay vigilant, stay informed, and most importantly, stay healthy. See you next time.